Started, it says. Hello, everyone. Welcome to our panel. Today we have some of my favorite moms joining us to answer some of the questions, and also so we can talk about clinical trials. We're going to talk about tips and tricks, all these sorts of things. So before we get started, though, I would love for the ladies to introduce themselves and tell us where you are located, and then not your age, but your name, the child's age. You can tell your age if you like, and the name of the trial. And if you're in a clinical trial, you can add that. Just don't say the clinical trial name. Julie, do you want to kick us off?
Sure. Hi, my name is Julie Ferrulo. We live right outside of Boston. My son Teddy is 6 years old, and he received a stem cell transplant in the spring of 2020.
Great. Miriam?
Hi, my name is Miriam Pedroza. We are currently in the Northern California area that's considered the Bay Area, just outside of Oakland. My son is Adam. He's 12 years old, and he's currently in a clinical trial.
Jeanette?
Hi, I'm Jeanette, and we live outside of Dallas. We have two kids. Dominic is 15, affected by MPS, and Jasmine is 20 in college. We are in a clinical trial, and Dominic was diagnosed way back in October of 2011.
Thank you. Jen?
Hi, I'm Jenna Steves, and we currently live in the Bay Area of California, right outside of Oakland. Have three kids. The affected one is Sebastian. He's 11 years old, and we are in the Bay because Sebastian's in a clinical trial. We moved here from Florida 3 years ago, so we've been here for a while.
Wonderful. I didn't introduce myself. In case you don't know, I am Kim Stevens. I have a son, Cole, who probably make his appearance with MPS 2, and he's been in a clinical trial since 2014. So we've had a lot of talk today about which is the best trial, right? Which one is, and my answer is always the one you can get into. But what were some of the deciding factors when you all were thinking about what treatments you were going to do for your child? Jen, you want to kick us off?
Sure. I think really understanding safety was a big thing for us. The trial that Sebastian entered was already running in other countries, and so I think that made us feel really good about it. But to be honest, we would have put Sebastian in most trials, kind of to Kim's point. He's in a blood-brain barrier crossing trial now, and if the other company who is offering something pretty similar had, if that trial was open for Sebastian at the time, we would have put him into that as well. So I think those were kind of the main things that we thought about.
Okay. And Julie, you did transplant. What was behind your reasoning with that?
Yeah, so Teddy was diagnosed when he was about 1.5. And at the time I think it was really January he got diagnosed. So when we were looking at potential treatment options, it was the beginning of COVID. I believe there was maybe one clinical trial that was starting, but it was, I think, halted a little bit because of COVID. At the time, there was really no options besides ERT. So, we were either going to, wait for one of those to open up. But in the meantime, I had taken time off work, and I had done like a pretty extensive literature review of all transplant cases from around the world, spoke to a lot of physicians, and parents who had done transplant, those also who had not done transplant, and that's kind of how we came to our decision.
And feel free to jump in, and you don't have to wait for me to call on you, certainly, but Miriam or Jeanette?
Well, for us, when Adam was diagnosed, he was 4. It was back in 2017. And at that time, I don't think I think there was maybe one trial, but it was stopped. It was discontinued. So we didn't really feel like we had a lot of options. So we went straight into Elaprase, straight into ERT. And we had done that for 4 years. And it wasn't until right when COVID hit, the same around that time is when we started looking into clinical trials. And I saw that there were already families up this way in the Oakland area that were in like the first cohort. And I think that's what kind of helped push us along. And then I know during the pandemic, we couldn't go anywhere, couldn't do anything. So I mean, I was just tunnel vision the whole time, is just, researching everything, making sure that we understood what we were trying to get into. And yeah, as soon as we were able to get in the trial, we were able to jump at that chance and do it. So it'll be 4 years this June.
And for me, it was sort of an easy choice. There was really nothing. Way back in like 2011, 2012, Dominic was diagnosed right before his 2nd birthday. We opted not to do a transplant at that point. The research just wasn't there back in 2011. I mean, it's changed a lot since then. And so we didn't really have much of a choice, but he did join the trial in 2015. And I think, just to echo what Jen was saying, I think safety was also a huge part of it. By the time we joined, there were already other families, and then I had spoken with other families. I had seen how other families and their kids were doing, and so it just was natural to like go into the one available option at that point.
Yeah. So some of you have talked about having to move. What was that like, and how did that impact your family or your work, or any of these jumping into these treatments, Miriam?
For us, I think it was just, it had to do a lot with where we were at and what was happening at that time. Like I said, it was during COVID. So there were a lot of changes. I was working from home. And Adam, my son, was doing online learning. So it was a little easier to make that transition to come up to the Bay Area. And at that time, we always just had, the notion that it's only 6 months, we're going to come right back. It's only 6 months, we're going to come right back. It's been almost 12 years and we're not going back. So I didn't know we were going to make this decision back then, but I know that getting up here was the right decision to make for us and our family and for Adam. It wasn't easy. I didn't think it was going to be easy, but I didn't expect everything, all the stress that came with it. But of course, no regrets there. And I know for us, because aside from adding on clinical trial things, we're also dealing with how like the disease is progressing within Adam, with the things that he had going on physically with his feet, with his hands. Since we've been up here, he's had 3 or 4 surgeries already. So when it came to that period of possibly coming back home, I didn't want to start over. And I think I tell this to everybody. I'm like, I had PTSD from, the surgeries that he had on both his legs. If we went back home, it meant that we were going to have to start over with our clinical team. And I felt that we had established a really good team up here. I felt like the hospital and the doctors and all the specialists that were there did know Hunter syndrome. They did specialize. I didn't feel like I had to go back and explain, what the syndrome was, and it's a rare disease and this, that, and the other. So I was grateful to be in a place where people actually knew what it was, and that, we had options. And That was like a really big factor for us, is to be able to be somewhere where we can access that type of care specifically for him.
Yeah, and Jen, you moved as well.
We did. It was crazy. We we had been honestly in contact with all the sites for all of the trials for quite some time, and you know, earlier on when these trials were coming out, it didn't seem like Sebastian was going to be a candidate for any of them because he's attenuated. So it was always just something that I was still watching, you know, to see if they ever opened up a cohort for attenuated folks. And um, when we found out that there was one, we spoke to the team out here, and we were actually inquiring more about a different trial. And Dr. Harmatz said that he could have Sebastian on a different drug within, I think it was like 2.5 weeks from the time that we heard that. So we said yes and went proceeded to, well, he said if, you know, depending on the screening and everything. So anyway, it was just like a total mad dash. Had a week and a half or so to pack up our house and get out here to California to start the treatment. So it was a wild ride, but I also have no regrets. I feel like we made the right decision for Sebastian. So
Yeah. And Jeanette, you've had to travel quite a bit over the years for the trial. So, you know, talking to people that are having to travel, what sort of tips do you have for them? And what have you learned from your many travels across the US for the clinical trial?
Patience. I don't know that I've learned patience, but I mean, it's tried my patience. Yeah, it's been 10 years of travel, you know, pretty much like monthly. And then on the point of the move, way back when, the company that sponsored our trial was offering to move, and we chose not to move and then to continue to travel. Because of, you know, the other kind of side effects that come with the move, kind of what Jen and Miriam was saying. You know, if you're changing states, for example, then, you know, where is the insurance going to be covered? So there's a lot of factors that come into play. So we chose not to kind of uproot everything and move, especially, you know, Jasmine, I think was, I don't know, around 7 at that point. So we decided, you know, traveling was better. We've done a lot of travel and we've always tried to make it fun. So those of you that do know me know that, you know, Dominic loves to travel. He loves his hotels and restaurants to the point where he doesn't like to be at home because we've made it like really fun to travel. So we always were trying to, you know, explore wherever we were traveling. We've now been in different sites for, you know, various reasons. We've moved and then there's COVID and then, you know, just life has happened. And so we've always made it fun. And I think that's, if anything, that's one of the tips that I would try and say. It's just, you know, it's hard for the kids too. You know, they're going and then they're going to be poked and, you know, say, you know, like tested and all these things. So try and also make it fun, go outside. You know, we did like playground tours, we visited different playgrounds. And another, I think, positive thing too was meeting a lot of different families as we visited these sites and then just talking to other families. So I have probably an extensive list of, you know, all the things that you can and can't do with travel that would take probably more than an hour. So I'm happy to follow up with anybody on the specific travels, but that's kind of what I would say. Just, you know, make it fun, and then try and meet other families because all those personal connections I've made, I think, are priceless.
I would agree with that as well. Julie, you had sort of a different experience. So can you share a little bit about what you
Yeah.
would advise with transplant or just tips in general?
Yeah, so we didn't travel for our transplant. The physician that does the genetic transplants at Dana-Farber, which is like 20 minutes from our house, I really connected with her. She had transplanted a couple of other Hunter syndrome boys, and also she specializes in like ALD and sickle cell transplants now. But you know, when we were first diagnosed, we weren't getting a lot of answers. Yes, and she was the first one to really kind of sit down and talk to me like as a mom and kind of tell me her opinion because I wasn't getting anybody's opinion. I felt like pretty I was relying on, other members of the community because every doctor I would talk to would either say something different or they were, couldn't really offer too much. So we were lucky in the sense that we were able to do our transplant like pretty much 20 minutes from our house, which is pretty rare. So at the time, Teddy was our only child. Dave and I could switch off going home every other night, which made it extremely bearable. Being able to sleep in your own bed every other night because you could actually sleep. So we had a very good experience that way. Kiddos who get transplants at Dana-Farber, the associated hospital is Boston Children's, which is where I work. So it was a really easy transition for me. I had a lot of trust in the nursing staff and the physicians. So it definitely made that part easier. We didn't look into any other centers, but we would have been willing to travel if we had to.
Yeah, I think one of the things that is so helpful, and it sounds like it comes from all of you, is talking to other families that are already in clinical trials or maybe further along in their Hunter syndrome journey. And that certainly has been true for me as well. So how has these treatments, that you've gone through, affected you and your family members? I know it's a very loaded question, but
I'm unmuted, so I'll start. Overall, Teddy's transplant was very successful. He's doing really, really well. So we've only really had a positive, experience. And we had our second son when Teddy was like 3.5 or 4. So we had a lot of time. He was our only child at the time, so we had a lot of time to devote to him. So we didn't, going through that with another child, would have been very difficult. So we were lucky in that sense. I think, my husband and I, we still have a lot of, I don't want to say PTSD, but, things from the hospital stay, all the scary stuff that happens, the diagnosis, it all happened really fast. And then it was COVID. So it's definitely a big impact at the time, but now I feel like, we're able to experience some normalcy because of the transplant.
yeah, I think that experiencing normalcy is another sort of theme that Jeanette tried to bring in as well, of you just sort of go with it, right? And as my child is coming in, as everybody knows, you go with whatever your child needs at the time. So Jeanette, you want to chime in?
I'm sure. I think, and it's not only like the clinical trial, or it's just life with Hunter syndrome. I mean, it affects your entire family, from how it affects us, to start with, us parents. There's so much fear, anxiety, sorrow, so many emotions all packed into one. And then just trying to, understand all that, understanding what, Hunter syndrome is, and then just balancing the time. If you've got other kids, like I mentioned, Jasmine was 5 when Dominic was born, 7 when he was diagnosed. And, balancing like kids' activities and that guilt sometimes that you can't be there for the other kid because you've got to be in the hospital. Like, I always remember, like, for her 12th birthday, Dominic had a port replacement. So we were in the hospital and we had planned a birthday party. But that's when I think like the community comes in. Like, another like family that was here locally, they took her, they had like a pool party for her. Like, it's just having kind of that support locally. But I do think, it's a family experience. And one of the things I always tell people is everyone's going to deal with it differently. Men, women, kids, everybody's going to experience differently. Some siblings are going to, like really kind of help out. Other siblings are going to be like, hey, you're like not paying so much attention to me. So it's just everyone has to kind of take their time and respect each other. Communication within the family, I think, is also going to be like really important. But yeah, it affects everything, everybody. holistically, I think.
And Miriam, you specifically said PTSD, and I think we all feel that.
Yeah, I mean, for us, I mean, like I said, Adam was 4 when he was diagnosed, and we jumped into ERT for the first 4 years. So I think at that point, we were so, like, that was our normalcy, just once a week infusions. And then when he had his follow-ups, his follow-ups were like, yearly. So it's not like we were in and out of the hospital as much as we were when we were in the trial. So I feel like even for him, for Adam, he was used to it. He liked going to the infusion center because of the kids' room. He had his little friends there, all of that. And then when we started the trial, all of that changed for him. So it did. So it's kind of like we were starting over. I can tell you, looking back, how it affected, me again, starting over, and then, my husband, how we had to, um, change our roles. When he started the trial, my husband was taking him more. And then now I'm the one taking him. So it's just being able to adjust to it all. And then just being able to remind ourselves that, it's their body, they're the ones going through it. We just have to advocate for them. Because I know Adam had a really hard time in the beginning. But now it's like he's back to, okay, this is my normal. I go to my infusion treatments, I do my follow-ups, and then there's, our lab weeks with the trial where he knows he's going to get blood drawn, things like that. So I feel like where we are now compared to where we were 3.5 years ago, we're like in different spaces. But yeah, I don't regret it at all one bit. And yes, the PTSD is real. For me, it was just because he had, the 2 surgeries back to back, and I just couldn't fathom going back home and starting up again at ground zero. And then at that time, there were other families that we knew that were also from Southern California that were commuting back to our trial site every week for whatever reason. Their at-home nurse, wasn't working out, or there was whatever issues. And I just couldn't picture us doing that. I was like, there's no way we're going to be commuting, whether it's driving or flying, every week for that. Um, if we're both going to try to maintain our jobs and do everything else. So that was a big reason too why we decided to stay.
Yeah, and Jen, I'm interested how you have these conversations in your family, and how do you decide to sort of divide up the work and the kids, or do you not, or how what do you do?
Um, well, I think, I mean, my husband and I have both had to do major career shifts as a result of this journey. We were both teachers way back in the day, and when Sebastian was diagnosed with hydrocephalus, so before the Hunter syndrome diagnosis, we realized this isn't going to work because he needed extra therapies and things anyway. And so I kind of think from that point on, we always kind of had it in our head that we needed to be ready to pivot. I think the PTSD description is real, and that for us, I think goes back to a really difficult stay in Boston Children's Hospital. I won't get into all of that, but where we realized, like, oh, the way that we thought our lives were going to go is not how it's actually going to go. And so from that point forward, we felt like we needed to be ready for anything. And for better or worse, I think it's definitely a trauma response. But it has made us keep just, yeah, ready to make shifts when they needed to happen, and definitely divide and conquer responsibilities. So I don't know if I fully answered your question there, but it absolutely huge shifts in all aspects of our lives, for sure.
Yeah. Miriam, did you have something to add?
Yeah, I just kind of to piggyback off what Jen said with as far as shifts, like now I'm, at one point we were both working. So we both had jobs that we were both juggling, and then on top of, getting Adam, to his treatments and everything. And then we jumped into the clinical trial. So now at this point I'm his sole caregiver. I was able to just not go back into the workforce, but now I'm just his caregiver 100%. And I made that realization, well, my husband and I made that realization that his needs are changing and we need to be there for him and not try to rely on, any, like nursing or medical staff, where when we know we can handle it and give him the help that he needs and have us there for him more, then of course it makes perfect sense for one of us, myself, to just be there for him and not have to worry about, okay, I have to, report to this job, but it's also taking away from my son's needs because his needs are constantly changing. So I think when people make that realization that you need to be there for your children based on their needs, then it does make it easier. I know it's not easy, but once you realize that, I feel like those decisions just become easier. And I don't think anybody should feel bad for it because these were the cards that we were dealt with in life and we're just dealing with them.
Can I add something? I think the bottom line is kind of, I think someone said this earlier, is each family has to do what's best for their family. Um, because not every family, is going to be like a mom and dad. And, not every family is going to be able to do that career shift or, you know, you move across the country. So I think in every case, every individual has to see what's going to be best for them, for their family. I think it's great to be there for your kid. I mean, I think all of us on here would love to be there. Unfortunately, not everybody can always be there. And sometimes we are going to have to rely on community. We're going to have to rely on caregivers or, nurses. And either way, whatever you're relying on, just don't feel guilty. Like if it's you and you're like giving, like 100%, you're working inside the home, you're still working, you're still doing. And if it's not you, if you're still like, working outside the home, it's okay. So whatever you decide for your family, it's gonna be okay.
Yeah, I like that, Jeanette. I always think about, at first when Cole was in the clinical trial, I was trying to do everything and just getting frustrated with everything and everybody. And, I finally made a decision for myself to say, okay, on those days where he's getting his intrathecal treatment, I'm not going to make meetings that day because trying to fit in meetings while I'm at the hospital was stressing me out so much. So, Julie, what were some of the decisions you've made that have helped you as you're negotiating Hunter syndrome?
Yeah, so similar to others on this call, I took a big step back at work when Teddy was diagnosed for the same reasons. Especially, I think when we were first diagnosed, we were going to so many appointments. I was so overwhelmed. I was taking meetings in my car. I was crying. It just like wasn't working out. So I ended up leaving my position, taking a leave, and then coming back to a different position in a more part-time capacity, which allowed me to then kind of be in charge in our family of taking Teddy to his appointments and to his therapies. As the years have gone on, I still kind of hold that role. I work like, from home, so it's easier for me to jet out during the day and do that sort of stuff. But yeah, it's definitely like I still sometimes get a little resentful that I, had to leave my job that I really, really liked and my career path that I had worked really hard for. Um, it was frustrating, but ultimately, um, it was the right choice. We also have like a really great nanny. So I used to take Teddy to like all his like private speech. And like this year, especially, I've just like she takes him now. It's fine. So it was kind of nice to be able to relinquish that control a little bit too. Like you don't have to be everywhere all the time, especially as the kids get older, like we don't go into his speech therapy sessions with him anymore. So you're just waiting in the waiting room anyway. So that's been something that was, we've had to navigate. And then I will say, like, also finding a community in our town with other special needs families has been so helpful. And a piece of advice that I had gotten was it's really helpful to talk to families who maybe don't have the same condition as your child because there's no comparing. And randomly, we've met like 2 other families whose kids have very rare genetic conditions, and they're all in school, and it's just been awesome to have that and kind of feed off each other and help each other out and all that.
Yeah, Cody has a good question in the chat about supporting siblings. She said she has 2 boys that are attenuated and their daughter is 18 months when they moved for the trial. So she's now 4, and I'm sure we've all dealt with this struggle with the attention given to the child who is affected. So any advice on what you do in those areas? I know, Jeanette, you said that Jasmine was very young when Dominic got into the clinical trial. So how did you sort of balance that?
Well, she was very young, but also she was older than him. So I know a couple of people here all have that other, perspective when the sibling is younger. And so I think, again, just trying to make time for her alone was really helpful. Like what Jasmine loves to do is dance. So I made it like a commitment to myself to always like be there. And I've been like at all of her performances pretty much, until like she went off to college, which I can no longer go to every performance because she's 3 hours away. But anyways, so like I was there with her and that was our thing. Like we always did dance. So like dedicating one activity and as much as I could, unless Dominic, of course, was in the hospital or we were traveling, like I was always there. The other thing that really helped kind of to go to a little bit of what Julie was saying is that local community. So our school district had SIP shops. And so she also met other siblings. And I know that now, here's a plug for Project Alive SIP shops because Sarah is starting those up. That really was an amazing program for her. I mean, they did a summer camp locally at a horseback riding place when she was about 9 or 10, and just meeting other siblings that really kind of had kind of the same questions, same feelings, and just talking about that openly. I think SIP Shops was a great program for her to join. So I would say, finding other siblings and also dedicating like one-on-one time to the sibling and it just find one thing that you both can do like with that sibling.
Yeah, I'm going to put in a plug for SIP shops too. Connor, who was behind me there, who was 16 now, participated in SIP shops, and it made all the difference for him. And he's not what I would call a super sibling, definitely, but he's adjusting in his own way, and we talk about the disease quite a bit. I've always been very open with him about what Cole is going through and the treatments that he's going through and why. I don't know if that's been helpful or not yet, because again, he's not a super sibling, but I think every parent, you have to treat your child, that may be differently. And explaining why Cole gets more attention and why he needs more attention than Connor does. It's hard. It's very, very hard to do. Jen, you have younger siblings. So how do you talk to Eliana about it?
Yeah, so we kind of have both sides of it. Because we have Omar who's 16, and the experience with that was dramatically different than with Eliana, our little one who's now 4. Because there were definitely more difficult conversations with Omar, which makes sense because he was older, but he just didn't understand. I remember him being frustrated with a lot of things, feeling like Sebastian would get away with things. that he never would have gotten away with doing when he was younger. And he was absolutely right. You know, Sebastian had to do so many hard things in hospital that we definitely bent rules more for him than we did with Omar, the older one. And so just, yeah, we were always very open with Omar, as much as we could be. And now that he's older, I really feel like he understands. I'm truly glad that we were open and gave him at least age appropriate kind of insight, because now he he just has this perspective that I don't think he would otherwise. He's truly starting to become a bit of an advocate for kids with rare diseases. And so anyway, that's been really interesting to see that journey for Omar. And then for Eliana, our little one, I just feel like she doesn't know anything different. Um, she had a really unique experience in general because she's a COVID baby. So her birth and early years looks dramatically different than the other kids. And yeah, I feel like she really doesn't question anything that goes on with Sebastian because it's just been her normal. Um, but I definitely think it's impacted her personality, much like Cody's daughter. I know Cody and her family, and I think both of our little girls are quite fiery, and it's probably largely because they've been through a lot. And so my hope for my little one is that it just makes her a better person, and that she has compassion, that she for others, because she's gone through things and seen her brother go through things that neither of them should have. But anyway, I think there will likely be conversations that need to be had eventually, but right now we just kind of take it based on what she needs, and there really haven't been a lot of questions so far. So
Yeah. Other additions to that? All right. Sorry, Cole it's late in our day here, so he is over me working today. So we have a younger sibling. This is from the chat. We have a younger sibling. It's normal, but the older he has gotten from birth to 9. I think the parents we take for granted and overlook his missing out on things. And I think we do that. I do that definitely as I look back now on some of the things that, as Jeanette talked about, there you sort of have to choose what you're going to be a part of. Connor's been very active in the band, so I try to get a caregiver for him on the week, or Cole on the weekends, so that I can devote my sole attention to Connor on those times. He doesn't get as much attention as Cole does, but as Jeanette said, you really try to focus in on that particular child at that time that you have with them, and realize that, this isn't an easy journey. None of us have it figured out. None of us wished for it or were prepared for it. So one of the questions, and we're going to get into some of the tips and tricks, how do you find quality caregivers and pay for them? I know that's all, we're all like the number of caregivers that we've gone through, right? So who wants to kick us off there?
It's really tough. And I know, when I talk to other special needs families, like we just got really lucky that we had found someone who kind of nannying is her career. She was trained as an ABA. She is awesome, and but we do pay a premium for it.
Mhm.
Yeah, really, really hard. Like sometimes I get nervous about we don't have the luxury of maybe hiring like a 15-year-old babysitter, you know what I mean, to come in. There's just like a lot to explain. Yeah, I mean, it's definitely we live, very close to a major city with tons of colleges, and it's still almost near impossible. I think the day that our babysitter quits, I'm probably gonna have a mental breakdown because I don't know how we'd replace her.
Yeah, it's hard to keep too. I mean, I've had a better time since I've moved to the Chapel Hill area just because I'm near the university and only 3 miles. And I've found that it's been really helpful for the whoever my caregiver is to find the next caregiver, and to explain to them. And that's been very helpful. And certainly if you get someone in a sorority that can talk to her sisters or good friends or neighbor or whoever it may be. Really ask for some help when you're looking for caregivers. I think that's important. And Julie says, the potty training, that really does put some people off because that's one of the hardest parts really to explain, is, you're going to have to help with pottying. Jeanette?
I was gonna say tapping into some school resources sometimes. Some of the paras that work in the classrooms,
Mhm.
they do that because, they just have huge hearts, or, even the teachers, and they, are used to kids that aren't potty trained. And in terms of the paying, that's also gonna vary big time, I think, depending on the location, depending on if get like any Medicaid waivers, or, what you can afford. So I think it's just, it's huge. But in terms of finding somebody, I would definitely seek out, maybe if there's a university, students that are local, like college students, especially, but schools too would be a really good resource.
Yeah, we've also had luck with some nursing students, because we're close. So, Jen or Miriam?
Well, we part of the one of the sacrifices in us staying up here in the Bay Area is that our whole support team, our family is in SoCal, so we don't really have that much up here. But that's why we made the decision to make myself like his sole caregiver. So I feel like we're fortunate enough to where we live in a state that will actually help caregivers for people, special needs kids or elder adults. So I'm a paid caregiver by the state. So that's me. But if we need like a babysitter, if my husband and I want to go out, we don't do that. I mean, unfortunately, I just don't feel like I trust anybody. My son Adam is hyperactive, and he'll try to, pull one over on you, and we'll try to run away, and he'll play tag all day long if he could. But I think if we are able to find somebody, it's definitely that trust that you're going to have is, and finding somebody that is going to want to be able to help with like potty training or toileting, issues, things like that, or somebody that would be well versed in, working with, special needs kids, because you can't just really have anybody just watch them, right? So. But that's why I feel like we're fortunate enough to where we live somewhere where I could just, stay home with him all the time and help him in any way.
Oh. Julie?
I don't think I have anything else to add there.
What are some
Yeah,
other tips and tricks
tips.
then? Tips that you would give folks outside of this
I
area.
I think, another Hunter syndrome parent had told me this, and I think about it often, that you have to like trust your doctors, but not blindly. Like you have to do
Mm.
your own research, stay informed, because really you're accountable for, your own decisions. And, like I mentioned before, I felt like when we were first diagnosed, we didn't get a lot of direction at all. It was either go home, try this, don't do that. And so I think, staying informed has been really helpful for me. I feel like it gives me some power. It's not my husband's thing at all. But that's okay because I like doing it. So that's, I think one tip I had, especially as you're evaluating other options.
Yeah. I think you hit on some good points there about staying informed, trusting your doctor, but also knowing that you know your child best, as we've had some folks say. earlier. So we've got about 10, 15 minutes. Other things that you would wish someone had told you when your child was first diagnosed, or maybe you did hear from someone early on.
I kind of just wanted to go back to something I think
Okay.
someone said or commented on about missing out on certain things for siblings. Yes, like they can miss out on certain things, and maybe, like Jasmine wasn't always able to be there. And I remember I used to tell her, but look at all this stuff we've been able to do. We went on Make-A-Wish. When else are you gonna be like, treated like royalty when you're on Make-A-Wish? Or, if we go to some local events and, like our families really like treat it like royalty, and you get like box seat tickets, and you want to try to forget the reason why you're getting this treatment, but it's like, hey, yeah, you missed going out here, but we were also able to do that. So sometimes like focusing on some of the positives, um versus kind of what you were missing out. I remember one time too, like Dominic was, newly diagnosed. He was like 3. We were in Delaware, and he had a surgery. He had his first carpal tunnel surgery, and there were some siblings that lived there locally. So while he was in the hospital and, he was getting his surgery, the siblings took her, and they took her to like the movies or something. And she met some amazing other MPS super siblings. So just kind of, again, focusing on the positive, like, yes, you might have missed out, I don't know, on something at school that day, but you got to meet all these other people, and you went to the movies, and you met people that you can actually like resonate with, like that they understand you. And so again, focusing on the things that you do get to do, even if we know that it's for, the reason that, our kiddos are affected by Hunter syndrome.
Yeah, that's very important, focusing in on the positive. And I think about that with the Make-A-Wish trip, right, where we were treated so well, um, and Connor loved it as a young kid. It's just as a little as he got older and he sort of saw that his brother was a little different, that he started to pull away a little bit more. So, that's reality for you. So others that have tips you're thinking about, I'm going to give my quick tip that buying indoor outdoor rugs for your house are like amazing. That was a game changer for me. But what others do you have?
I'll just throw in, don't be afraid. I know a lot of people think, especially when the kids are younger, like screen time, like, oh, this is all I can give them to settle them down, but it's too much. It's not. I mean, I think that's probably what like society wants us to think, but you know what? If giving your kid the tablet, the phone is going to calm them down while they're at a doctor's appointment, or even if they're just at home, whatever it is, like don't feel bad and don't let other parents guilt trip you because you're doing things different. Because you have a totally different situation. You have a different child than they do. You're not living that life that you thought you were gonna live. And so you're forced into doing things a lot differently and unconventionally, and you're gonna get stares and maybe comments, but you know what? That's all it is. It's not important. You're going to do what's best for your child, and if giving your child a tablet or technology to calm them down and to give you 5 minutes, do it. From our community, there's no judgment.
I'd love that. No judgment from that. Because a lot of the times it is. I mean, I'm the one that's so nervous to take Cole out in public, right? Because I'm
Yeah.
afraid of the stairs. Cole doesn't care. Cole does Cole's thing, and as you see, and just does whatever he wants to. So he doesn't care what other people think. But there's a lot of it is what I put upon myself in those. Jen or Julie?
Yeah. I feel like for me, especially earlier on in diagnosis, it was really important that we found our people. I think that there's so many people in the community that helped out so much, and I don't know how we would have survived those early years if it weren't for them. Um, So other parents, and then also the medical team too, don't feel like you only have the people who live, the team that's in the area where you live, because we have a really amazing team of doctors who know a lot about MPS and Hunter syndrome specifically around the country, who are so willing to help out and give advice. I know early on, Sebastian was having reactions to Elaprase, and his geneticist was like, "Well, I guess he's going to have to go off of it then." That was his answer, like, that's it. But I had my mom team, who I could ask, and they were like, "Oh no, absolutely not. This is the doctor you need to talk to." And it was actually Dr. Burton, who, I don't even know if she remembers this, but she wrote a whole protocol for Sebastian, turned it, like, gave it over to the geneticist. So I think finding your people, both the medical team, but also people, just other parents and community that you click with, is so important. And the other thing I would say is, along our journey, a big piece of survival for us, I think, has been just trying to take it one step at a time, like being able to be aware of what is in front of you in the distant future, and the different paths that you might take to get there, but ultimately focusing on what you can do right now, sometimes literally this minute or maybe this day. I think just that perspective has been really helpful for me, and it's actually been really helpful for Sebastian too, because Sebastian has a lot of trauma. And so just being able to kind of help him focus on, like, stop worrying about, 2 weeks from now when you have that big appointment, what do we need to do right now? What can we do today? I think has been really important for us.
Yeah, I echo what Jen said. I, struggled a lot with anticipatory anxiety. And when we were first diagnosed, they used to say, like, day by day, and I was like, if one more person tells me that, I'm going to lose my mind. Um, but it is kind of true. Another thing that has helped us a lot is trying to do things we wanted to do. Like, we wanted to have another child, and the way we did it was a little bit different because we did IVF with our second. But trying to, like, maintain, that level of normalcy. And I also see a question in the chat about, is it devastating to meet other MPS kids who may be worse off than your child? And that's something that I had struggled with. And surprisingly, no, I don't think so. I feel like the interactions, like, when we were in Dallas this year and the other Hunter syndrome conferences have been so positive. Like, Teddy and Adam became, like, best buds, which was just, like, really adorable. So I would say that is something I also struggled with. But then when we did meet other families with kiddos that were at different stages, I don't feel like there was actually any fear. It was more connection and that sort of thing. So I just did want to address that because that's something that, um, I had struggled with as well.
Yeah, and I think Kristen has answered in the chat as well, and that's a great way to think about it. And going to the conferences and sort of seeing the other kids, and I know I fall in love with all of them right away and think of them as my kids, which is probably the parents are going, I don't know about this lady, but that's the way I feel about it. So we have just about 5 more minutes. We had a question in the chat about medical tracking devices. And shoe IDs, electronic tags. I know for Cole has a shoe ID. It's I bought it from Road ID, and so he has it on his shoe because that's the only place where he wouldn't take it off. But now that he's not wearing shoes, I have no idea. So if anybody has other ideas, I do have a tile in his backpack, so I at least know when he gets to school. So others have ideas.
I guess I would just suggest, like, for someone like us, like, a medical bracelet, just like name, phone number, and anything that you'd want somebody to know. But Adam did used to elope a lot, but it was more like I'm over this place. I'm out of here. I don't want to be here. But he would stay when it would happen at school. He'd stay like on campus. He'd go to the classroom next door or something. So for us in particular, that having like a tracking device for him wasn't something that we were looking into. But I do feel like a bracelet, like a medical ID bracelet would be beneficial to help.
Oh. I have one that I have in the car that actually talks about Cole, because a lot of the times it is just the two of us. So if I always think if I'm in a car accident, how is somebody going to convey that Cole has Hunter syndrome? And I know a lot of the other family caregivers have put something actually on the car seat if the child is younger, or on the seat belt. And yeah, Jeanette, hold it back just a little bit and you can. No, we can't see it. You'll have to tell us about it. You can't get off mute. So having something in your car is helpful. Having something that, airway. And then I know Project Alive has something, the Hunter Syndrome Foundation. Jeanette, you're off mute now.
Yeah, no, it's just a sticker. Ashley, my belt, made it for me, and I actually need to put it on my car.
That would help
But
it.
it just says, child with special needs, Hunter syndrome, unaware of danger, may not respond, may resist help. You can, just do like a quick little decal for your car. But I'm interested too in hearing about what you have in your car, Kim. So maybe I'll just follow up with you on that one.
Yeah.
Hmm.
It's something I've made on the runner sites, just a little dog tag that says that, because he is nonverbal. So he's not going to and he's not going to follow commands, right? And as he gets older, I worry about that quite a bit. And as he gets bigger, as well. So, all right, we had some really great, I'm just going to go around and let you add one more thing that you might want to, maybe something you wish you knew, or something that you just want to leave folks with in our last few minutes. Who wants to go?
I'll just jump in for something I wish I knew. For us, like, because we struggled a lot with behavior at different points also. So I wish I knew that it would have been okay for us to look into behavior meds earlier on. I know it's taboo still sometimes. And then I know coming from my husband and I both grew up in Hispanic households. So meds, behavior meds, no, you don't need a behavior med. You need to be disciplined harder. And that's where we were at. But I wish somebody would have told me it's okay, talk to a doctor about behavior meds. You're not doing anything wrong. Because had somebody told me that earlier on, I would have stopped questioning, are these behaviors syndrome related behaviors, or do I just have a really bad kid? So had somebody told me that earlier on, I think we would have probably made that decision a lot sooner. And I'm glad that we did make the decision to get him on some of those meds. And when we did, we were at our wits' end. Because of all the changes that he was experiencing. But a big part of me wishes we would have started sooner to maybe make things easier for him. And as if it would have been easier for him, then things would have been easier for us, and we would have been able to deal with that aspect a lot better. But we did it when we did it, and now we're not turning back. So don't be afraid to do that if you're questioning it.
And Kristen brought up in the group, make sure you're in the Hunter syndrome online group in Facebook. It's amazingly helpful for some of these questions of asking about behavior or meds or any of the other. So if you're not on that, you can reach out to me, or you can reach out to Kristen and we can add you in. Others, we've got about 2 minutes.
Just quickly, I think just to piggyback exactly on what you're just saying, my thing is, it's not that I don't know that, somebody would have told me, but ask for help. It's okay to ask. It's okay to look for resources. And I think from the beginning, I was, like, okay, how can I help? But there's a lot of organizations out there, including Project Alive, but there's also local organizations that might be close to you. Reach out to Project Alive, reach out to Sarah, like we can try and connect you with some of your local resources. Some of the stuff we've talked about, you might be thinking, oh my gosh, like I can't afford all that. Like I can't afford respite. Like there's an organization here locally in North Dallas that'll provide 25 hours a month for respite care, and they pay somebody $25. They will provide equipment too. If you're at a hospital, there's the Ronald McDonald houses, which can be amazing. So there definitely are so many resources. I think, just asking for help, join that group, reach out to Project Alive, reach out to other organizations, because that's why, like it's part of the community that we have, and, just talking to other parents. So that's my plug. And I know it's, definitely a plug for Project Alive, but, reach out, because there are a lot of resources out there, and hopefully we can help you find them. We're talking with other parents, I'll help you find them.
Mute. I think we are out of time. So if you have questions, go ahead and put them in the main chat and certainly I'm going to answer. But I think to Jen's point, find your tribe, find your people. Sometimes that's someone that has a child that's similar, that's at the same age. It may be they have similar family situations, but find your people. And certainly the whole community, those are your people. So ask questions, ask for help. So, all right. So if I hope some people are going to join me in the advocacy session next because I'm late.